All right, listen up to this. The coronavirus may pose a new risk that we're finding out to younger patients. So let's find out more about it. Joining us live this morning is Dr. Vishnu Brahmandam with Memorial Hermann Neuroscience Associates in the Woodlands. Joining us live to help us out. Good morning to you. So we're talking about stroke here. Tell us what's going on with this and what you're seeing, because we're understanding that sometimes a stroke is the first symptom of coronavirus for them.
Hi, good morning. Thank you for the invitation. Yes, sometimes, especially in younger folks under 45, stroke can often be the first symptom of having COVID. It's not very common for that to happen, but stroke is not very common in the young anyway. So it's one of the things we have to start looking for when we see people coming in with stroke.
And do you have any idea why coronavirus is increasing their risk for stroke?
It's more than one thing. Coronavirus is so immunogenic, meaning it activates the immune system so much that it actually causes the blood to get thick. And thickened blood makes it easier to form a clot. And if that clot gets lodged in the arteries in the brain, you end up with a stroke. So that's one mechanism. Another is that your oxygen levels can get low. And when that happens, a brain that's already got a blood clot in it is now, in addition, starved for oxygen. And that just tends to compound the stroke and make it even bigger. Those are the blood clot kind of strokes. There's also the bleeding kind of stroke, or a hemorrhage. And even though COVID causes clots, it can also cause hemorrhage. And we've seen many times when people get both. They get the clot, and then that area of the brain converts into a hemorrhage. And it gets very complicated very quickly.
We know that time is on your side, and you really need to get help as quickly as you can if you're having a stroke. So can you walk us through some of those warning signs so that if someone is experiencing any of them, they can get to an emergency room just as soon as possible?
Absolutely. The onset of stroke is very quick. Within a minute, you get to have symptoms of one-sided weakness, one-sided numbness, trouble speaking, and that can be slurring your words like you were drunk, or it can be trouble comprehending what other people are saying. It can be that tip of the tongue feeling where you can't quite get the words out, but it's in your brain. Less commonly, you can also get vertigo, which is a spinning sensation. When that happens, you have to seek care right away. Don't try to drive to the hospital or get your loved one to drive you in the car, because if it gets worse in the car, you're stuck. You're better off calling 911. The first 4.5 hours.
Very quickly.
Yeah.
Mm-hmm. I was just going to ask you very quickly, is there anything that someone could do to prevent having a stroke?
In terms of COVID, get the vaccine. The best treatment is prevention, wearing the mask. But aside from that, it's the usual things that your doctor tells you. Watch your blood pressure, watch your sugar. But you can get to the hospital in time and still have a chance of reversing the stroke. So time is of the essence.
All right. Well, thank you for this important message from Memorial Hermann this morning. An honor to talk to you, and we appreciate your help.
Thank you again. Stay safe.